Welcome to CARE Podcast 5, focusing on employment. Of course, the ultimate goal for every internationally educated nurse is to find a job as either an RN or an RPN, and CARE is there to support these efforts. Today, we're fortunate enough to have two colleagues joining us by telephone to share their insights regarding CARE's Observational Job Shadowing program and Work Strategies program. Lourdes Vicente. Hi, Lourdes.
Hi, good morning, Ruth.
Glad to have you here.
Oh, I'm happy to be here.
Lourdes,
thanks for inviting.
Lourdes is the coordinator of our Observational Job Shadowing program. And also we have Shirley Bell, a clinical educator from St. Michael's Hospital. Hi, Shirley.
Hi, Ruth. Thank you for having me, too. Hi, Lourdes. How are you?
I'm good. Hi, Shirley. Nice to hear from you again.
Good to have everybody here. Before we begin the discussion about these two interesting programs, I really would like to share some background information about these two remarkable nurses. Lourdes has an educational background in both practical nursing and career and work counseling. 19 years work experience supporting internationally educated professionals. And aside from being a full-time case manager at CARE, she facilitates the employment strategies workshops and coordinates the Observational Job Shadowing program. So really is very engaged in both of these initiatives. Shirley, a clinical educator at St. Michael's Hospital, has been practicing nursing for over 30 years in general medicine at St. Mike's and has been a clinical nurse educator for the past 11 years. The service, General Internal Medicine, provides quality care to a diverse demographic population, an increasingly diverse population, with a variety of both primary and secondary diseases. Shirley really acts as our clinical on-site role model and leader to support nursing care that optimizes patient outcomes and experiences and really enhances safe, effective accessibility of patient care. So really pleased to have both of you here with us today. Let's start by asking Lourdes to share a little bit of information about Observational Job Shadowing program. This is pretty interesting. Tell us all about it, Lourdes.
Thanks, Ruth. Observational Job Shadowing, or OJS as we call it, is a program at CARE for nurses. It is a unique learning experience in which a CARE member is partnered with an expert nurse who is experienced in the Ontario healthcare system. It's an opportunity for a CARE member to observe a nurse during their work shifts to see firsthand the nursing profession in Ontario. It's very similar and yet different from volunteering opportunity. With OJS, CARE member will learn about the scope of practice of RPNs, RNs, and nurse practitioners. It's strictly observational with no direct hands-on patient care, typically ranging from 2 to 3 shifts, and the CARE member will job shadow the expert nurse for an 8 or 12-hour shifts depending on the facility. And they have an option of doing the placement in a hospital, long-term care, or in a community setting. Currently, we have 16 employer partners in Toronto, Peel, Hamilton, Niagara, and Kingston areas. And we are still trying to expand this list in order to serve our CARE for nurses locations. And by the way, we're happy that we have also Shirley here because St. Michael's is one of the partners of OJS.
We're always happy to have the OJS students at St. Michael's Hospital, specifically on our medical unit, because as Ruth mentioned, the medicine unit is very diverse with regards to the type of population that we serve. And for the OJS students, the OJS nurses, this gives them an opportunity to see what it's really like to work in a hospital in Ontario, so that'll actually get them ready to work across Ontario wherever they may get a job. And what we do when they do come in, I'm a little biased because I want them to be really comfortable. So what we do majority of the time is we try to pair them with other IENs that have been working at St. Mike's on our medicine unit for quite a while, or even the newer IENs that we've hired, because it actually gives them an opportunity to talk to another IEN that's been working in the hospital for years. It gives them an opportunity to talk to them about their work experience, how do they prepare to get interview and stuff like that, and talk to them about the type of patients that they have to look after and what are the expectations with regards to coming in as an internationally trained nurse in an organization such as St. Michael's Hospital. So it does help when we do pair them up with IENs. They feel a little bit more comfortable when they know that the person that they're actually buddied with is somebody that has gone through the experience that they're currently going through.
Yeah, so Shirley, thank you about that. And again, thank you for supporting our IENs. In partnering with an IEN, it also motivates our care members that, you know what, one day I could be in their position. At this point, I could be a participant. One day I could be a provider. I could be an expert nurse as well. And I've seen that, and they're very helpful because, again, it's a way for other people to give back. It's a support because they've already received some support in the past, and now they're trying to support other IENs as well. So thank you again for that opportunity.
You're welcome.
This sounds really interesting. I really am interested in the way you select the expert nurses, Shirley. I think choosing an expert nurse who has some passion and who can share a common experience, I think has got to be a real advantage. But Lourdes, tell us a little bit about what do the clients need to do to prepare for this experience?
So when it comes to the requirements to participate in OJS, we treat it like an IEN is preparing for a clinical placement. They have to complete an OJS application and sign agreement forms. They have to complete a detailed learning plan. So the learning plan is very important in this placement because it basically addresses the learning goals and needs of the IEN to their expert nurse. The IEN also should have a valid CPR, current immunization records, and police clearance. And they have to have also an accidental insurance and completion of few courses that they could basically address it with their case manager. So their case manager is their first step in order to apply for a placement. So they will be able to help them and let them know what are the documents that will be needed. And after that, I connect with the facility and find out if there's any opportunity for a placement. Usually it is within a certain time frame. Usually it's between 2 to 3 shifts. So it's up to the client to schedule the dates with the facility or with the expert nurse. And again, every facility is different. But as I've mentioned, the first step is going through their case manager, complete the documents, and from there I'll be able to reach out to the facility that they want.
Well, I'll pipe in here then, because once Lourdes reaches out to the organization, i.e. St. Michael's Hospital, so they connect through the student center. So there is a student coordinator that handles all students that are coming through the facility. So the student coordinator will connect with me, forward me all that information that Ruth has asked the IEN to prepare. So I get everything. I see a picture of I see their driver's license, all the expectations, the required documents that are expected for them to actually start. And then once I see that, I actually call the IEN and I make a connection via telephone just to get a little bit of background and to get a little bit of information about where they're from, even though it is in their resume that they do forward and the past experience that they do have. So once I've connected with them, I usually get a little bit of idea about the type of person they are, listen to their personality. When I'm chatting with them, I try to make them a little bit more comfortable before they actually come in. And so once I've done that interview on the telephone, I have an idea who I want to pair them with, because I want their experience to be very, very rewarding, and I want them to be comfortable. So I'm very specific with who I select for them to be with. If it's somebody bubbly, if it's somebody that's a little nervous on the phone, and I know who can coach and mentor and be very gentle. So I'm very specific with regards to who I do then buddy them with, because as I said, I want the experience to be very rewarding, and I want them to be comfortable, because it will be their first time in an Ontario hospital with regards to what are the expectations and what are they getting themselves into when they do actually apply for a job in one of these organizations. So I like to say I'm very particular about how I handle the IENs, because I want it to be a very, very good experience for them, because my expectation is that I'm getting them ready to then make the next step with regards to getting a job.
Well, what a good caveat, Shirley, leading into some discussion about our employment strategies workshop. This certainly, observational job shadowing, is a wonderful foundation, really acquainting nurses with the reality of nursing practice in Ontario. So then they're, of course, anxious to be looking for their first job. So can you tell us the kinds of things that employment strategies workshop covers in order to help nurses prepare for that job search?
So Employment Strategies Workshop is one of the workshops that we provide care for the IENs who are already about to look for employment. So we look at their interests, their skills, their experience. It's more of a time for them to really sit down, think of what they could offer to an employer. So we provide, during these workshops, we have different workshops, and one of them will be creating a resume, a targeted resume. We always let our clients know that it has to be a targeted resume and cover letter that's specific for this particular position that they're applying to. Help them to look at their skills, what other certification that's needed for a position. So resume, cover letter will be critiqued by case managers, as well as one of the things too that we are really happy that, again, St. Michael's is helping us and Shirley's helping us is with mock interview. So as we know, one of the things to get a job is to ace the interview. So we provide a job search workshop that includes the resume, cover letter, and interview as well. So we help them what are the different questions that might be asked, how to answer it properly. And then at the end of it, we have a chance to invite employers to come and share their time with us to do mock interviews. So basically our clients will have a chance to meet an employer, do an interview, get them some feedback, and they find it really beneficial. And one of them is Shirley, and she's always been our supporter when it comes to our mock interview as well.
So I actually have fun doing interviews because I do interviews at St. Michael's Hospital for not just nurses. I sit on lots of interview panels right across the organization. So when Karen asked me to do this, I was really excited about doing it and getting the IENs ready. So as part of the mock interview, again, I do see the resumes and the job that they are applying for. So I do the interviews. I'm learning. We just did one recently, and it was virtual. It was very well done, actually, doing things. Zoom has been amazing with regards to getting these things done. So what I do the interviews, and we ask the questions, and I look at everything with regards to how do I get somebody ready, or what do you need to do to get ready for a job. So at the end of the interview, I do feedback. So I give them feedback on their resume. I look at their grammar, their spelling. I remind them to do a spell check. Is it neat? Is it clear? Is it well organized? Because I tell them your first impression is your resume. That's the first time I am meeting you by looking at your resume. I may not have spoken to you at any point in time, but your resume is going to speak to me. So your resume is your first impression of what it's going to tell you a professional story. It will be the deciding factor in whether or not you get an interview. So your resume must sell you. I also talk to them about how do they write their resume. And Lourdes, you alluded a little bit to this with regards to this is the questions you're going to ask yourself. What kind of job am I applying for? Making sure that when you look at the posting, it is whatever is in the posting, I already have that. It's part of my training, my experience. It relates to the job that I'm applying for. What are the assets? What are the qualifications that I have that is going to get me an interview? So what I tell them to do when they're preparing is making sure that you research the organization, research the hospital, and look at the qualifications that are in the posting, because those qualifications should be in your application. You have them. If it's saying you need at least 5 years experience, I do have that 5 years experience. If it says that I need experience in nephrology, I have experience in nephrology. Whatever it is, the qualifications that's on the posting should be the same qualification that is in your resume. You're not lying. You're just rewording it to match what is the qualifications in the application, because when the organization pulls the resume, it is done through the HR process. The HR department pulls the resume, and what they do, they put in keywords, and at least if 80% of the keywords that is in the posting pops in your resume, that's the resume that's going to get pulled from HR with regards to analyzing the job posting and analyzing your resume to make a match, and then that's what they're going to pull to put to make sure that you're the person that
Yes.
is to do the interview. So I also talk to them about how to prepare for the interview. So make sure you research the company, make sure you research the services that they provide, looking at the organization, what kind of population they serve, because that's the population that you're used to serving if it's medicine. So making sure you think about what you have to offer them. So make sure that when you're talking about these things, you're selling your things, bring extra copies of your resume, because lots of times on a panel, somebody might be sick or they may pull another person in. And I, as a last-minute additional to the panel, may not have had the opportunity to see your resume. So bring extra copies of your resume, because it gives the other members of the panel a last-minute opportunity to review your resume. So make sure you, again, look at the job posting, know what you're coming in for, because we're looking for candidates that have the experience that we're looking for. And I also encourage them, and I tell them it's really key that you practice. So the mock is an example of practicing, but you also should be practicing with your friends. Record yourself on your telephone to see what it looks like and to play it back so you can hear, because there's a lot of times where there's a lot of pauses, a lot of slang words that are used, a lot of ha, all of that. So I mean, it is nervous. It's nerve-wracking. So what I tell them to do, and a key thing that I tell them to do, and I do this for other companies too, I said to think about, as Ruth, as you said, it's like you're chatting to somebody that I don't know you. I've never met you before, so you're telling me a little bit about yourself. So think about it as you've gone to a dinner party, and we've met, and it's the first time I'm meeting you. Hi, who are you? Tell me a little bit about yourself. So anything on the resume, it's not a test. It's questions that we're going to ask you that you should have the answers to, especially regarding your clinical practice. I also talk to them about first impression with regards to dress code. It's really important that you dress the way dress. I said, don't dress to impress. Dress for success. And that's my slang word that's used for them. So you don't have
Those are really excellent words, Shirley. You want this all to be successful, for sure.
So don't dress to impress. And what I tell them is, like, you just need one outfit, one pair of black pants, which nobody knows it's the same pair. It could be multiple pairs of black pants, I don't know, and maybe two tops. A button front shirt or a blouse, nothing loud, because it is really important that you present yourself for success. Make sure that you have this ready for as soon as you get a call. If I call you today to say, can you have an interview this afternoon, you need to be ready. So have that outfit ready to go at all times.
These are all wonderful tips, Shirley. Shirley, don't give away the whole employment strategies workshop.
All secret.
But these are wonderful tips, and I think they've really, our listeners will really take a lot of information away, both about the observational job shadowing, which is a good foundation in terms of familiarizing yourself with nursing in Ontario and a particular area of practice. And then, of course, all those wonderful tips from Shirley about how to be successful and how to dress for success. And this concludes the podcast number 5 in employment. I want to give my thanks to both Lourdes and Shirley for giving so generously of their time. And for further information, please go to the CARE website, www.carefornurses.org. And thank you for listening.